everyone, I'm Christine Echevarria, your second-year student nurse from Southwestern University, FINMA. In today's video, I'll be performing urinary catheterization for male. So catheterization is the process in which the catheter is inserted to the bladder to collect or drain the urine. First thing first is we need to check the physician's order and of course introduce yourself to your patient and verify your patient using the two identifiers. And of course, provide your patient the opportunity to raise or ask of their concerns during the procedure so that they will know on how she can participate. And of course, provide your patient comfort and privacy. Wear your gloves and do the hand washing to prevent the spread of microorganisms. And of course, prepare all the needed materials such as set of catheter, which includes the sterile water, betadine, forceps, urobag, catheter, 10 cc syringe, fenestrated drape, plaster, and 2 sterile gloves. And position the patient into the dorsal recumbent position with knees flexed and feet flat on bed. Hi, good day, sir. May I know your name?
Adrian,
When is your birthday?
April 8.
What do you want to call you, sir?
Adrian.
Okay, Adrian. So, the procedure that you are going to do is the urinary catheterization. So, catheterization is the process in which the catheter is inserted to your bladder to collect or drain the urine. Then, it will help you relieve the acute urinary retention. And of course, I will be touching some parts of your body. Is that okay with you?
Yes.
Okay, let's do it. So now, let's fold the covers, let's bend your knees and spread. Then we're gonna expose the area. Then, we have a kit of Foley catheter, the size is 12 French. Let's open it up. And it says here 5 ml. So that's how much the balloon is inflated to. So when we open a sterile package, we first want to open away from ourselves, and then the other side, and then the other side, and toward ourselves. So we can take our sterile gloves. So now, we can get our supplies ready. Let's cover the patient with fenestrated drape for privacy. Make sure you will not touching anything. So I improvise fenestrated drape using the bond paper. And also it says in the kit, do not test to inflate the balloon prior to insertion because it's gonna be difficult and more painful to insert. So now let's clean the private part of our male patient using cotton ball with antiseptic solution in the male. What we gotta do is touch the penis and stick it straight up, and then let's start cleaning. Go one at a time, then discard because it's dirty to avoid the spread of microorganisms. So now, I'm gonna insert the catheter and dip it into the lubricant. Okay, sir, can you please take a deep breath because it's slightly uncomfortable? So how far do we insert? So how do we know how far to insert? So when we see the urine return here in the tubing. Now you might encounter some resistance on a male patient because a little bit large prostate. If you do encounter some resistance, just keep pushing through it until you see the urine. Resistance doesn't necessarily mean that you are in the right spot. Especially, they had a large prostate. So I will keep pushing until see the urine in the tubing. That's how you know that you are in the right spot. So now, we're going to inflate the balloon by pressing the 5 ml syringe. So now we can disconnect and we don't be sterile at this point. So, the tubing, we're gonna attach it to the thigh. For male patient, we do not put it under the leg because this can cause pressure. Then, lock. Make sure that the urobag is hooked correct in the position to avoid backflow of urine, which gonna cause retention and pain for the patient and infection. Make sure to hook in the non-movable and we're hooking in below level of patient waist. So after the procedure, clean all the materials and dispose the syringe and gloves. And let's do the hand washing. And let's cover the patient. Done. After washing our hands, let's document the procedure. So, patient Adrian Camigeng, 12 French of catheter, the urine is clear. Thank you.